Can double lung transplants offer new life for CF patients? Imagine a treatment that can give someone with cystic fibrosis a fresh start with their lungs. For those with advanced lung disease, double lung transplants can be a real hope. When cystic fibrosis causes severe damage to the lungs, it can make breathing difficult and limit daily activities. Doctors usually consider a transplant when lung function drops below 50% of what is expected, signaling that the lungs are failing. A lung transplant can stabilize breathing, reduce symptoms like coughing and fatigue, and improve overall quality of life. On average, people who receive a first lung transplant live about 9 to 10 years afterward. That's a meaningful extension of life, and many patients report feeling better and more active after the procedure. However, it's important to remember that a transplant is a complex surgery with risks. Patients must take medications called immunosuppressants for life to prevent their body from rejecting the new lungs. These medications can have side effects and requiring ongoing medical care. Sometimes, despite the best efforts, the transplanted lungs may not work as well over time. Chronic rejection can occur, and in some cases, a second double lung transplant might be considered. This retransplant can give additional years of life, but the outcomes are generally less favorable. The median survival after a second transplant is around 3 years, with about 3/4 of patients surviving the first year and fewer making it to 5 years. Many patients on the waiting list for a second transplant do not survive long enough to receive it, which highlights the challenges involved. Deciding to go ahead with a lung transplant involves careful evaluation by a team of specialists. They look at the patient's overall health, lung function, and other factors to determine if the benefits outweigh the risks. Early discussions about transplant options are encouraged so that patients can plan ahead and be ready when the time comes. In the end, double lung transplants can offer a new lease on life for people with cystic fibrosis facing advanced lung disease. While the procedure can significantly improve survival and daily functioning, it also requires lifelong management and careful follow-up. Each person's situation is unique, and treatment decisions should always be made in close consultation with healthcare professionals who specialize in cystic fibrosis and transplant care.